Welcome to segment 3, where we'll be covering safely transporting a child in a vehicle. Without expert instruction, it is very common for caretakers to improperly install their car seat. It is highly recommended that caretakers are consulted by a nationally certified child passenger safety technician when installing their car seat for the first time. By visiting safekids.org, you can locate a car seat technician in your area. If you are planning to install the car seat yourself, be sure to both reference your vehicle manufacturer manual as well as your car seat manufacturer manual to ensure proper compatibility and safety. Be sure to install your car seat at least a few weeks prior to your baby's due date. You do not want to be installing the car seat for the first time in the parking lot of the hospital. A few basics about your car seat that you want to ensure are: you have the appropriate seat based on the age, height, and weight of your child. The car seat is in the appropriate position in the vehicle. The seat is facing the right direction. The car seat is level. The seat is firmly secured by the latch system or safety belt with the tether anchor used when called for. There is no more than 1 inch of movement side to side at the site of the belt path. The harnesses are sized and positioned appropriately with the chest clip in line with the armpits. You are not able to pinch slack in the webbing together at the level of the child's shoulders. Newborns and infants will be in a rear-facing car seat and secured with a 5-point harness, ideally until they meet the height or weight maximum established by the car seat manufacturer. In a rear-facing car seat, the shoulder strap should be at or slightly below the child's shoulders. Usually between 2 to 4 years old, the child will meet the height and weight requirements to use a forward-facing seat with a 5-point harness. In a forward-facing car seat, the shoulder strap should be slightly above the child's shoulders. Usually between 5 to 9 years old, the child will meet the height and weight requirements to travel now in a booster seat. Usually between 8 to 12 years old, the child will properly fit into a seat belt with the shoulder belt crossing over their shoulder, the lap belt crossing over the tops of their thighs, and their feet rested firmly on the floor of the vehicle. Children under 13 years old should always travel in a back seat. The safest place to install a car seat is in the middle position of the back seats. In this position, the child is the furthest away from the airbags should they deploy, as well as any intrusion into the vehicle in the case of a T-bone collision. Any items that are unrestrained in the car seat and the vehicle can become projectiles in the case of an abrupt stop or a collision. Examples are juice cups, bottles, toys, iPads, and even mirrors that slide over the headrest if they aren't secured with a strap. When using a carrier seat with a child in it outside of the vehicle, always set the carrier seat down on the floor or a flat surface. Avoid elevated or unstable surfaces such as beds or sofas. Carrier seats are not recommended places for children to sleep outside of when they're being transported in a vehicle. An improper angle of the seat on various surfaces could potentially restrict their breathing.